HIV stands for Human Immunodeficiency Virus. As its name implies, it is a virus that affects only humans. The virus operates by attacking T cells, which it uses to reproduce. The virus travels between humans via the use of bodily fluids, such as blood, semen, preseminal fluid, breast milk, vaginal fluid, and rectal mucus. Other bodily fluids that contain high levels of HIV include amniotic fluid, cerebrospinal fluid, and synovial fluid. Individuals afflicted with the virus will display flu-like symptoms within 2 to 4 weeks of infection. These symptoms include fever, swollen glands, sore throat, rash, fatigue, muscle and joint aches, and headaches. However, individuals that display these symptoms aren't necessarily afflicted with HIV. Individuals can take an HIV test to find if they are HIV positive. After its flu-like stage, the virus will enter what is called its latent stage, in which the virus can go up to 10 years without showing any symptoms. During this time, the virus reproduces at very low rates and is generally difficult to detect. By the later stages of an HIV infection, the immune system of the infected individual will be largely shut down. It is during this stage that the HIV virus causes its afflicted individual to develop the acquired immune deficiency syndrome status, otherwise known as AIDS. Symptoms of late HIV infection include rapid weight loss, recurring fever, profuse night sweating, extreme tiredness, prolonged swelling of the lymph glands in the armpits, groins, or neck, diarrhea lasting longer than a week, sores of the mouth, anus, or genitals, pneumonia, colored blotches under the skin or inside the mouth, nose, and eyelids, and neurological disorders such as memory loss and depression. Sexual contact can spread the HIV virus, and mothers infected with HIV can pass the virus onto their unborn fetuses. In addition, mothers can pass HIV through breast milk. The virus can also be transferred by sharing needles or through blood transfusions. The virus is only able to reproduce inside of a human host, meaning it will not survive in external conditions. This being said, the virus tends to thrive in poor, largely urban areas, which explains the prevalence of the virus in many parts of sub-Saharan Africa. Large urban centers in more developed nations also are known to host a large population of individuals afflicted with HIV. Groups that are disproportionately more likely to be afflicted with HIV include men that have sex with men, Latinos, and blacks. As of 2009, blacks accounted for 44% of newly diagnosed HIV cases, and 1 in 16 black men will be diagnosed with HIV, as well as 1 in 30 black women. Most new diagnoses occur in cities with 500,000 or more people. As discussed, sub-Saharan Africa has a disproportionate number of HIV cases when compared to the rest of the world. 63% of new cases worldwide are found in this region, making it a target for many HIV-related studies. Afflicted individuals can take an HIV test, which detects the antibodies that form in response to the virus 25 days after infection. Afflicted individuals are said to be HIV positive. A drug called azithromycin has been readily available since the late 80s that is able to slow down the effects of AIDS, but it is otherwise unable to cure HIV. More money has been spent on finding an HIV vaccine than on any other type of vaccine. Preventative vaccines can be administered to train the body to recognize and fight off the HIV virus, that is, when they are perfected. HIV vaccines have been tested in over 25 different countries. There is good news, however. Due to the increased availability of testing and treatment, HIV transmittance in the USA has decreased by 89% since the mid-1980s, the time of the last AIDS epidemic. The Joint United Nations Program on HIV/AIDS reports that the number of people in Africa receiving the viral treatment has increased by over 7 times between 2005 and 2012. The number of AIDS-related deaths in 2011 was 33% less than the number in 2005, and the number of new HIV infections in sub-Saharan Africa in 2011 was 25% less than the number in 2001.